So I'm Phil, I'm from CODA, and we're from up country in Christchurch. And some of you might know about us as a music organisation, because that's what we have been for 25 years or so. And throughout that whole time we've been engaged in arts and health and wellbeing programmes. So throughout that whole time we've run a music therapy service. We've worked for over 20 years now in one of our local special schools, Linwood Special School. We've run a whole range of kind of interventions in health and wellbeing, from Parkinson's choirs to dementia programmes, stroke rehabilitation programmes, programmes in hospices, a whole range of health and wellbeing programmes over the years. What's exciting to us at the moment, there's quite a lot of exciting things going on at CODA at the moment. What's one thing that's really exciting at the moment, which is what I'm going to talk about, is in June of last year, we merged with an art therapy charity, a charity called Hampshire Art for Recreation and Therapy, and broadened our scope. So we are now CODA Music and Arts Trust. And that new inherited programme that we've started to work on has been really fascinating for me as someone who's worked in music for my whole career pretty much. And I wanted to talk a little bit about that work, because I think the things that Heart have brought to us and that we've inherited will also, I hope, be of interest to you guys. So one of their key programmes they called Arts on Prescription, and it's a progressive programme that is enhanced and runs alongside an open programme of creative wellbeing art workshops. The Arts on Prescription programme is a 14-week programme that's run by a clinical art psychotherapist and is focused on people with quite high and severe mental health needs. And then there's, as I say, a kind of progression programme that runs, it's an open programme that runs weekly, year-round, which the clients that attended the Arts on Prescription programme can fall into if they wish. It's interesting to us, I think, their programme for a number of reasons. The first, actually, is just the topic itself, which is working with people with mental health needs. Actually, at CODA, one area that we hadn't really done a great deal of very specific targeted work in was with mental health. And coming out of the pandemic, Heart's programmes were really relevant to a number of people in the local area, and continue to be. So, and we've really are very tangibly aware of the crisis in mental health support, where we are. I think the CAMS waiting list is over 2 years for young people, and the work that Heart have been doing, which we've now inherited at CODA, is very tangibly meeting a crisis, a gap and a need in our local community. So that was one area that's been really important and fascinating for us to work in, and how we can actually couple, because there's a need, maybe sometimes it's open doors that in the past have been quite challenging to open within GP surgeries and other kind of NHS partners. The other area that's been really interesting for us to explore has been this idea of progression, and the way that the clinical art therapy programme couples with a more open wellbeing programme that people can move into, and is a regular provision for them. So I think I mentioned the clinical art psychotherapy programme is 14 weeks, and that 14 weeks is working in a group up to 10 people, but in a very clinical therapy way. So really, really supporting people with high levels of mental health problems. That includes people with suicidal tendencies, manic and acute depression, and a number of other issues. So it's really kind of valuable work. Oh, that's my 5 minutes up already, but that doesn't count because I had to fiddle about with the thing at the beginning. The other area that I think is really important for us is the way the programme was modelled to work with social prescribers. So right from the very start, the programme was very much linked in to that kind of emerging world of community link and social prescribers that were forming around us in the GP surgeries. And although that took some time to really take off, actually now we've become so well known amongst those social referring groups that we get tons of referrals, too many in fact for us to deal with at the moment. So all of our programs now are really at capacity and full, and the relationship that we've developed with social prescribers in terms of referring is really working well. And the final kind of area, I suppose, that was of real kind of value to us learning from is around the evaluation model. And again, when the programs were set up by Hart, the evaluation model was really centred on providing the kind of evidence that those social prescribers and others might need. You know, often as a fundraiser for an organisation, I sort of bend to the kind of needs of a funder, but these programs were really interestingly set up. So they use, you know, formal techniques and surveys like GAD-7s and PHQ-9s, but and so we can get very, very kind of clear information about progress made by the clients that are participating in the programs. But they also explore other things too. So, you know, we build a wider picture up by documenting some of the work made. We do case studies and observations on the clients that are taking part, and we really focus down on those progress that is made by those clients so that we can demonstrate that. So people going from being a client to being a participant and then returning to life or becoming, you know, many become volunteers for our programs too. So that's been a really sort of valuable and interesting program for us to explore and learn from. And that question of evaluation leads me to my provocation, which is evaluation who cares. And that's not really intended to be a negative question. It's just more around us clarifying why we are doing these things. Again, as I said, sometimes as a fundraiser, you focus on those ideas of gathering information because you hope one day that the NHS is going to give a great big check to you to carry on this work. But actually, there are many sides to evaluation and the benefits of it. And I think sometimes it's just worth reminding ourselves of those different perspectives and what we're trying to achieve.